microphone, and I hope it works. I'm Cathy Levine, Executive Director of UCAN, Ohio, and it's working? I'm Cathy Levine, Executive Director of UCAN, Ohio, and co-chair of Ohio Consumers for Health Coverage. Thank you, Affordable Care Act. So, why aren't more people out here today? Because they're at work or they're at home and unable to come here today. But we know how many people are benefiting from the Affordable Care Act. You heard the numbers. What I'd like to do is tell you the story of somebody, of a typical Ohio family that desperately needs the Affordable Care Act. This is a story from Cleveland, from Dawn Ring. We've always been, this is Dawn's own words, we've always been told to pull ourselves up by our bootstraps. I grew up in the 50s and 60s. I was raised in abject poverty. Fast forward to today. Dave and I have been married almost 38 years. We've lived in our house for 21 years. We've raised 2 grown children and have 2 grandchildren. We have never lived beyond our means. We both put ourselves through college. Now, as we approach our 60s, everything seems to be crumbling under our feet. We have lost most of our retirement money. And this is our big, irresponsible sin. I got aggressive cancer at the age of 41. Then Dave got cancer at the age of 52. Neither of us has ever smoked cigarettes. The for-profit insurance companies have been squeezing us financially for decades. As of August 1st, 2011, we had to give up our health insurance coverage for the first time in our entire lives. Now we are scrambling to see how or if we can continue our prescription medications. Now let's fast forward again. In August 2011, we were forced to drop our coverage because they priced us out of the market by raising our rates to $2,500 a month, $30,000 a year. We simply could not afford $30,000 for premiums, which don't include co-pays, co-insurance, deductibles, and other things insurance doesn't cover. The rings are not unusual, but now, today, Dave is enrolled in Ohio's high-risk pool, the temporary pre-existing insurance plan set up by the Affordable Care Act to help people between now and 2014. So Dave is getting comprehensive affordable coverage. Dawn is trying to get on Medicare for her long-time disability, which has been improved by the ACA. Dawn and Dave played by the rules all their lives, but the rules were not written for them. Now, with the new law, they face a more secure future. How many more families, through no fault of their own, are going to lose their life savings because they dare to get sick or injured? How many people are going to lose their homes, file for bankruptcy,